Hi. Hi, everyone. Hi. I just want to make sure I preface this with this is not a 90 Day Fiance gossip live. That'll be reserved for tonight at 10 for Friday Night Live. Hi, Ashley. Hi, Ashley. Lots of Ashleys in. So the gossip stuff is going to be later tonight at 10 for normal Friday Night Live. This is what I'm doing today is a live consultation. You guys who have been my regulars know that I really have an issue with this part of my does double chin thing. That I am really self-conscious about it and I really don't like it. You guys have known that. I've talked about it. Well, I am going to be working with Dolce Aesthetics in New York to get Kybella treatment for that. So since I can't go to New York right now to actually do it, we're going to do a consultation over the phone. We said, let's do it live. Might as well, right? So she's going to be on here shortly. And thank you guys. She's going to be on here shortly and we're going to talk about Kybella, what it is, and like all of the normal consultation stuff, what I should expect, what, the other uses you can have for it. I'm also going to ask her a little bit about my TMJ, because they do Botox here, and that helps the TMJ. So I'm going to talk a little bit about that. We're going to talk about that a little bit. So this is going to be fun and pretty. If you want the 90-day news, come back at 10 for Friday Night Live, and we're going to have all of that for you. So, hi, you guys. Botox for TMJs, God, awesome. So she's going to come on and talk about it. She just needed a few minutes. Green looks great with my eyes. Thank you. Thank you, guys. How are you guys holding up while we wait for Jen? Her name is, they call her Dr. Jen. And you guys know I've also complained about my lips. I know you guys are like, don't do it. But the thing is that she's going to be able to explain is she can do them very subtly. And we'll talk about her prices too. Yeah. She actually has really reasonable prices because she does such a high volume. Her store does such a high volume. Ashley, you guys say hi to Ashley of Ashley and Jay. She's there. And so I want to talk to her a little bit about lips, my lip. Her name is Jen. She does, she runs the Dolce Aesthetics clinics, Metaspa clinics. Kybella is not surgery. It's injectables. It's non-invasive injectable that they shoot up into here. The only problem, and she'll talk about this, you get a bullfrog swelling like a week after and then it'll go away, but it's permanent and I can't wait. TMJ is she's in New York City. She's got offices in Queens and Brooklyn, I think. Is it an all-girl show? No. Don't do your lips. Please. No, it's not an all-girl show. Not at all. So, yeah, if those of you guys have been with me for a while, you know how much I've been complaining about this. The TMJ is, I grind my teeth really bad, really, really bad. So, it creates like these big muscles right here. And you can, if you Botox into them, that helps relax them and freeze them so you don't grind as much. Oh, here she is. All right. So I'm very excited. Jen's coming on here in a minute. You're going to love all this. You guys are awesome. There she is.
See you.
Hi.
How are you? How's everything?
I was just explaining to my followers because I've been normally when I go live, they're expecting to hear gossip about the show, and that's not what we're doing today. And that
so it's a little different.
It's a little different. We'll be doing that later tonight, but the ones who've been following me for a long time know how much I've been complaining about this for eons. And
so you have an issue with your double chin. That's
bothering
you.
And so I've been looking into Kybella and then, started looking and put in touch with you. And that's what we're going to talk about. And
and then we were talking about TMJ stuff and other stuff. So people in the comments are very excited. They're like, is this an all-girl show? I was like, no, men can join.
So nice to meet you face to face. How are you?
Yeah, good. How are you?
You're beautiful. Nice to meet you.
Thank you. You too. I mean, I've seen you before. I'm obsessed with your work. So.
Thank you. Thank you. So I know that you were concerned about the double chin. And you know, it's something that I have a lot of issues with patients who are, you know, excuse me that I'm playing with my hair. It always seems like I play with my hair more online because you can see.
Yeah, because you can see it. Yeah.
That's all you're looking at. So excuse me. So I have a lot of patients who that's their problem is the double chin, and Kybella is the treatment of choice for that. Kybella is usually it's deoxycholine. That's the drug name of the product, Kybella. And what it does is it kills fat on contact. So not that it's going to be one treatment and this is all going to be gone.
Right.
You have to do several treatments before it goes away. So depending on, how much girth there is there, how much fat there is going to be dependent on how many treatments that you're going to do. Right. So, most patients do anywhere from 3 to 5 treatments. Some people can get away with 2 or 3. It's just going to be dependent on you. So I'm looking at you. You're probably going to be, you're going to be at least 3 treatments for you.
Okay.
At least
that
3.
makes sense.
It'll at least, and it's anywhere from 6 to 8 weeks that you're going to be doing the treatment.
Okay. And now somebody asked, is it surgery? I was like, no, it's not invasive. It's injectable, but there is some downtime with this procedure. Yes, so can you explain what that is, what that's going to be?
Sure. So, you are going to look like a bullfrog for about a week. You get very swollen in this area. I've done it too. It's not that bad. Now you're still be able to wear scarves and able to wear, a turtleneck. It's not so bad, but I mean, you're getting into, the springtime. And of course, now we're all on quarantine, so it doesn't matter if we did it, but unfortunately I'm not doing any procedures now.
Right.
But however, it's about a week to 2 weeks that you'll have that swelling, and then it starts to dissipate. It's not that bad. I went through it. I did it like 5 times. I did it about 5 times myself, and I still have a little bit left, but my chin was like this. But it was. My chin had a little girth to it. But yeah, I mean, the swelling isn't so bad. It's about a week, sometimes 2 weeks it could take. Every day it gets better. I tell patients, it's part of it, and the light at the end of the tunnel is that it's permanent. It will never come back. Right. That's the best part about it.
That's the question. And one of the questions we're seeing below is that it is, how often do you need it? Like, what's the upkeep with it? And there isn't. Once you go past the initial couple of treatments, then that's it. You're done.
That's it. You're done. And I mean, you can't gain 50 pounds, however, but but you have, it is permanent. So that's great. So as long as you don't gain any weight, it's permanent, which is great. And it is a little costly, to do it, but like I said, it's permanent, so it's good.
Yeah. So somebody was asking about liposuction versus Kybella for under hair.
Liposuction is very expensive. It hurts. You have to go under anesthesia to do it. You're paying a lot more to do liposuction. This is in office. It's quick. It's easy. It's an office visit. You can do it anytime you want. It's not like you have to schedule the surgery or go under anesthesia. So it is a little bit longer of a process, but however, it's a safer process, and you don't have to go under anesthesia to do it.
Right.
So it's a few injections, and initially it burns a little bit when you're getting the injections, but it's fairly pain-free. 0 to 10, it's probably like a 3. That's the worst of it. 3 or maybe a 4, but 90. I wouldn't even call it a 4.
Here's the other.
It's pretty painless.
Watching some of your videos, I learned that you can use. I learned that you can use the Kybella in a couple of other areas too. Now, one thing that many years ago, 6-7 years ago, I had a full mommy makeover where I had a breast reduction, I had lipo, and I had a tummy tuck. after I did that, it left
good for you.
Yeah, it left my fupa, I guess you could say, that the womanly pad area,
okay,
really like fat, like looked like 70s bush, even though it wasn't. So they did some lipo on that to get it to get it down. But my understanding is you can also use Kybella for that.
Right.
Is that true?
Yes, you can. You could do Kybella. Yes, it's true. It's an off-label treatment. Right now Kybella is FDA approved for the double chin, but we do it for off-label treatments, which is the bra strap fat, the fupa, which is the little area by your vajayjay, and the back, the back fat, those little wings you get in the back where your bra kind of hangs off your back. And actually above your kneecaps. Above your kneecaps is a big area where people want it done, because that's the area, when we get older, it kind of collects there. It's kind of, you have that little, right above the kneecap, there's a little area where it kind of collects. So, women in like late 40s and 50s and going into their 60s, that's an area that's of concern for them. And we could do it there as well.
Okay. So that is my priority, number one on my list, my wish list, that I have.
Oh, there's Ashley. There's a hi, Ashley.
Yeah, she is. That I have to save.
Hi, Ashley.
That I'm saving up for. The other is I wanted to ask you about the Botox for masseter for these muscles because of the TMJ and because I grind my teeth like a crazy man and the whole thing. So can you explain what that is?
Sure. So there are a couple of things that I do. Well, first of all, the masseter muscles it's twofold. So one thing it does is it takes away the symptoms. It takes away the grinding. It helps take away the pain, the headaches, the clicking. That's one side of it. That's the medical side of it. The other side of it is actually slimming out the jawline, which is the more cosmetic side of it. So
cosmetic
it works very well for both. Right. The cosmetic end is where it's going to slim out the jawline. So it's like a win-win all the way around, because not only are you going to get that relief, but you're also going to be able to slim out your jawline with the Botox as well.
Okay. And how many vials or units do you usually have to use for that?
So, if you are symptomatic, which means, you have jaw pain, clicking,
right, which I am,
grinding, things like that. Right. That would be, we would start with 50 units per side. And that would be like the base dose. That's what's recommended to start. I always start a little bit lower with patients to start them out and graduate. So I do a 25 per side. And then I graduate. I tell them to come back in 3 weeks, see how it's going, see how the symptoms, resolve, if they're resolved, if they're resolving. And then we add more. And then we know moving forward that is the amount that which we're going to use their next time that they come in. So you're going to have to, and every patient is different. You curtail it to the patient, because some patients have very, very bad TMJ that you might have to do it more frequently. Some people have to do it every 3 months to get that relief. So it's going to be it's really dependent on the person. It's really dependent on the person.
Someone in the comments,
and how bad of symptomatic they are.
Okay, someone's asking how it slims the jawline. How the Botox.
Okay, so what happens is obviously So the masseter muscles is a muscle that it's a jaw muscle. So what happens is if you are symptomatic and you do grind your teeth and you click and you have jaw pain, these muscles get very strong, so they make the jaw wider. They make it appear wide, the jaw, but it's really the muscles that are wide. So what happens is when you reduce, so think of like a fist. So think of like when a muscle is contracted, it's a tight fist. So when you inject the Botox into the muscle, it relaxes the muscle, and that's what helps slims out the jawline.
So that makes sense.
What happens. Yeah, I mean, it helps the muscle relax. We don't like to say shrink. It doesn't atrophy. It doesn't shrink. It just relaxes the muscle. What it does is it cuts off there's nerves that hold it holds the muscles. Okay, so the muscles are contracted. So basically the Botox talks to the nerve and says, stop contracting muscles, and it just releases it, and that's basically what it is. So it cuts off the communication from the nerve to the muscle.
Okay. So I get Botox in my face and head and neck every 12 weeks for my migraines. Would doing Botox for the masseter muscles be too much Botox? Can I do that? Is it contraindicated in somebody like me?
No.
Okay.
It's you're doing it in a different area. I mean, I wouldn't, if you're doing it in your forehead for migraines, I wouldn't add more Botox, cosmetically, because you probably have enough. The only other thing is when you're getting Botox from a neurologist, it's very different than getting it from somebody who is an injector, who injects, is an aesthetic injector, because they don't care. They don't care if they get rid of your lines. They're doing it to get rid of your migraines.
Right. There's a very specific there's a very specific protocol.
So that's
where
why
they
a
have
lot
to
of patients
inject.
walk out with their eyebrows like this when they're getting it done by a neurologist, because they're not watching where they're injecting it. So what I tell patients who are patient like you is basically let your injector do your forehead, let them do every place else, and let me do the forehead, because then I'll inject it in the places where it needs to be injected, but it'll look better. So your eyebrows won't be like this.
I see. Well, I haven't had any issues so far. She seems to know what she's doing with it. So, so hopefully, so I could still do the additional Botox in here.
Yeah, that's not, no, it's not
be
a problem. No.
Okay, so the last thing that that's on my list that I have to save up for is giving me a little bit of an upper lip, since I have none. I have no upper lip, but I don't want to look like a clown.
Okay, so as far as lips, I mean, I use Juvederm Ultra Plus in the lips or Velour on the lips. If you just want a small enhancement, you can just do one syringe, which is 1 cc, and it's very small. It's a 1 ml. An ml of filler is a teaspoon, so it's 2 thumbnails full. So if you look at your 2 thumbnails, that's all it is. It's a very little bit of product, so it'll give you a very slight enhancement. It's not a lot of product. When you do the lips, it's something basically you want to build on, because if you do it and you don't maintain it, it goes away. So your body can absorb it pretty quickly. So I always tell patients with lips, it's something you want to evolve with. You don't want to, you're not going to have it where you're going to come in, it's going to be one and done.
Okay.
So something that you're going to want to, maintain.
Okay. So you could take something like what I have here, which is nothing, and make it just look like a natural lip.
Yes. So you have a very small
and not like
lip. So you're gonna So you're gonna want to probably build on it, because what's gonna happen is you're gonna do the filler, and you're gonna see a small change, and then as it graduates and as we build it, I tell patients it's a lip evolution. No, I'm not a doctor. I'm a nurse practitioner. Not an RN. I'm a nurse practitioner. Yes. So everybody calls me Dr. Jen, but no, I am a nurse practitioner. Thank you. So it's something that you have to build on.
You gotta ignore my
evolution. No, it's okay. It's all right. I don't mind. I don't like.
I get a lot of trolls. I get a lot of trolls.
You got trolls?
A lot of trolls.
All right, burnt toast. You got it? I actually had burnt toast today, by the way. Anyway, so yeah, so it's something with lips. Like if you look at the girls on my page, these are girls that have done them for a while and they've built on them. So if you see the pictures that that you're looking at, this is something that they evolve to. So it's a building block. So when you're doing injectables, any injectables anywhere in the face, it's something that you have to maintain. It's something that that you have to it's something that you have to it's not going to be one and done. It's not like you're going to do it one time and you're not going to come back and do it for 2 or 3 years. Even though yes, could filler last for a certain amount of time? Yes, but not the absolute effect is going to last for 2 years. So like if I took an MRI, I could see filler in the face for 2 years. However, it's not going to stay, the correction is not going to stay there for that long. So it's something that you have to maintain. So it becomes kind of a way of life. I tell patients, this is a luxury, not a necessity. This is something that we don't need. And I will never tell the patients that we need this, ever. This is something that you have to understand, that it's a cost, and you have to, you have to put that into your budget. And if you can't put in your budget, then something that you might not be able to do. And that's
right.
what it is. I mean, and that's basically, you know, how it goes.
Yeah. So I guess, so people seem to think when I mention that I'm considering getting my lips done, they seem to think it's an all or nothing thing. Like either it's going to be huge duck lips or nothing. Like they don't seem to understand that there's a range within there. And your philosophy on this is, you know, you curtail everything to whatever that specific patient wants. Now,
yes,
if someone gets their lips done properly, like you can't necessarily tell that they had their lips done, right? Because you did it in a natural way. So,
right.
you know, I don't know if you maybe can explain a little bit like the sort of the continuum of, you know, some women want the really big lips and some don't, and you curtail your treatments to that.
Yeah.
Like,
So
not a one size fits all.
And thank you for. No, so I tell patients, this is what this. There's a spectrum. So here's the lower end of the spectrum. Here's the higher end of the spectrum. I treat patients accordingly. Every patient is different. Some patients who like a very little bit, they might look at somebody who, well, that's not for me, and vice versa. So you have to treat everybody differently. You want to curtail the treatment to each patient. Some people want a little zhuzh. Some people want them a little bit more, you know, more fuller. So, you know, it's every patient, it varies. And I'm a philosophy where, you know, you want to give the patient what they want. You don't want to overdo it. And you also don't want to underdo it, because you don't want patients to say, I went there and I didn't see anything, or I went there and she overdid my face. So I do turn patients away. When people come in, you know, when the people come in, I tell them, you know, it's enough. I tell patients, actually, listen, I don't want to see you for 6 months. You don't need any more. Seriously. And I tell them that, and that's the truth. But there is a spectrum, and that's my philosophy. You have to treat every patient accordingly. Everybody's different. Everybody has their own visions of what they want, and you got to talk to your patients and figure out what's best for them. And what's the best treatment for them, and what the best course is. You know, everybody has their own vision of what they want to look like. You have a smaller upper lip, so it might take you a little bit more time to get to the you know, and you have a little bit unevenness on the top, so you might have to, you have to do a couple, not just to give you girth and give you width. When I do lips, I also do structure, and it's very important that we structure. That's the most important. You know, not just filling lips to make them look like two sausages. You want them to look, you know, you want them to look structured and have a formation. So, you know, you'll have a nice base to start off with. You do have a nice shape. So it will, as we evolve it, it's going to look even nicer and even better. So, and you're going to love the treatment. You are going to love the treatment.
Am I? Okay.
You
well,
are gonna love it.
this coronavirus needs to so I can get up to New York. I mean, I am, there's a reason why I'm coming from Washington, D.C. to New York to see you to do this, right? Because of the volume of work that you do, the people that you work on, you have the expertise to do this. You know, I have a plastic surgeon who did my mommy makeover, but, you know, he probably doesn't do nearly as many lips or Kybella treatments as you do, right? There's a reason I'm going to be coming up to New York for this.
Well,
and so I know a lot of people are asking about cost too, and I know your cost, having looked at your website and everything, you guys, her prices are on her website, which is great. You don't always see that, but her prices are on her website, but your prices are really, really reasonable.
Yes.
I was surprised at how reasonable they were.
So, well, I cater to the middle class. I am middle class, so I cater to a lot of middle class, and I want it to be, you know, affordable for them. And I know, as a person as a middle class person, I'll pay for something that I'm going to get a good treatment for. If I'm going to get a good service, I'm willing to pay for it. And, you know, I provide a good service, and I also, you know, make it affordable for them. I'm not too much. I'm not at Park Avenue prices, and I'm not bargain basement prices.
Well, the bargain basement prices, I think you get what you pay for, right?
Exactly. You do get what you pay for. And there's a lot of people out there that should not be injecting. And that's the truth. I also, there is a lot of people out there that have no idea what they're doing. You know, you have to be an artist. You have to be an artist to do this. You know, listen, you have to know anatomy. You have to have, you have to know didactics and understand where, nerves are and things and structures that you have to avoid. However, that's not only the part of it. You have to have an eye. And if you don't have both, then that's where the injector falls short. So I have both because I have the didactics and I do have the eye of an artist eye, and I've been doing it a long time. So
I was just going to say, how long can you tell my followers how long have you been doing this?
I have been doing this now for almost 20 years. I've been doing this since
that's
2000.
a lot.
Yeah, I was one of the first when I was an RN, because I was an RN first, to clarify. You have to be an RN to be an MP. So I was one of the first RNs, because there's an argument about me being an RN or an MP.
Yeah, they're just being trolls.
I don't know.
They're being trolls.
I'm an RN. You have to be an RN to be an MP. And by the way, I am getting my doctorate now, so they'll have to call me Dr. Jen when I get my doctorate. But but MPs are doctors. We do the same things that doctors do. So, we should be called doctors anyway, because we do the same things.
You have prescribing authority.
Anyway, we prescribe. Yeah, I have prescribing rights. I have my own DEA number. So, and PAs don't have their own DEA number, by the way. They have their doctor.
They have to do it under the physician that they're working under.
Yes, they have to do it. Not MPs. Not MPs. Not MPs.
Right.
MPs have their own DEAs. Anyway, so what I was saying is that I've been doing it since I was one of the first RNs that learned actually how to inject many years ago. So, and I've developed, my craft now, and I've been doing it for a long time. I have my own methods. I treat every patient individually. I look at you like a piece of artwork. You're my blank slate, and you're going to be my artwork. So, you will be very happy with the treatment. I am sure you'll be coming back and telling your viewers how much you love your treatment. And I can tell you, I can be assured.
How many can I get done on the same day? Can I do Kybella and a layer of lips at the same day? Or do I have to space all those out?
Some people can, it just depends on the person. I think for the first time, you might want to separate it, just because if you've never done it before, it might be too much for you. But but if somebody who has been doing this for a long time, I have patients who want to just do it and get everything done like that one day and be done and come back in 6 months or 9 months and they're okay. But, if for you, you might want to space it out.
Okay, so people in the comments are asking how they can get in touch with you. I'm going to post. You're already posted in my stories, but I will post something for them so they can get in touch with you. Somebody else also asked if Tom goes to you, Tom Brooks, and the answer to that is yes, he does. And you guys, I'm hoping to work with him where we both go in to see her on the same day.
That would be fun. That would be fun to have you do that. That would be fun. Yes. And Ashley comes to me too. Ashley's one of my very dear friends. And we actually have a lipstick line coming out soon.
Yes. I'm very excited about that.
Exciting. Yes.
Yeah. I'm excited to try that. And then
it's gonna be great. You're gonna love it. You're gonna put on your new lips.
On my new lips.
Hi, sweetie. I'm just saying hello to one of my
yeah.
So no, Darcy doesn't go to me. Darcy doesn't go to me. I don't know who Darcy goes to, but Darcy doesn't go to me.
Because her lips on this season are bad, really bad.
She don't come to me. Yeah, she does not come to me. I do not take credit for that.
She needs to go to you.
She should. I want her to come to me. I told her she should come to me. So, but listen, everybody has their own people, and you you offer, and that's all you can do. I love for her to come.
Right.
So, but she needs to slow down a little bit. She does. She is a pretty girl. She's a beautiful girl. Her injector should tell her, don't put any more in. She's a very pretty girl. If I have a patient, I tell them, don't do any more. That's all. That's that's my. That's me. I would tell patient no. So, but
you wouldn't sugarcoat it.
And she needs. No, I want to sugarcoat it. I'd be like, no, you don't need any more. I want to see you. Goodbye. Take care. you know, but yeah, so I would love, if she wanted to come, I would love to treat her. She, you know, she's a pretty girl, and, you know, she doesn't need any more than her face. She should just slow it down. She really should. She should. She's a very pretty girl.
Yeah, she
anyway,
is.
yeah, I don't want to say anything. I don't want to step on anybody's toes.
No.
So, but yeah, Tom comes to me. Tom has done Botox with me. He's done some a little bit of filler with me. We've done, you know, just very little. Even Ashley too. She doesn't do a lot. You know, we're very conservative. You know, listen. Everybody has their own, like I said, has their own thought of what they want, but you know, they're on TV, so they should, you know, people are gonna notice everything they do. Yeah. And you don't want them to notice. Yes, Tom does look good. Thank you, Andrea. Thank you.
People, you know, I'm a huge fan of letting people do what they want to do, and you know, if she wants to do that with her body, she can. If I want to do this with my body, you know, I think everybody should have that autonomy to do what they want, and everybody has different kinds of tastes. Like, people tell me, oh, you don't have a double chin, you don't need to do that. And I'm like, okay, that's fine. I'm sure I look great with that, you know, the way it is, but it really bothers me. And as someone who's had plastic surgery before, I'm very much you know, take care of what you can take care of, right? If I can afford it, if I can do it, then if it's in my budget, why not, right? So, you know, I'm a big fan of that.
Listen, if you can do it, you should do it. You should treat yourself. I mean, that's what I tell patients. This is, like I said, this is a luxury, not a necessity. If you want to do it, don't let anybody tell you not to do it. You have to do what's good for you, and they have to do what's good for them. If somebody doesn't want to do it, God bless them. They don't have to do it. Nobody's forcing anybody. I tell anybody who comes to my office, nobody's forcing you to come in here, and I will never force somebody to do it, because we don't need this. We do not. This is 100%. I'm not saying that you need to do Botox and fillers, because we don't. No, so I don't want anybody to say that I'm saying that. I am not. We don't. We need food, air, and water. That's it. And shelter. Yeah. That's all we need. We don't need anything else. Yeah. It becomes a necessity, though. It becomes a necessity after a while, once you see how good it looks. But
we'll see. I know, right? Right. But,
so I'm going to be excited when you come in to see me. I'm excited to see you when this all is over.
Once New York is safe for visitors, and you know, I have multiple sclerosis, and so I'm on a couple different medications that suppress the immune system. So I'm one of these high-risk individuals that can't go out into the world right now. So I've got to wait till it all completely dies down, so that I can get out there. But I've got a couple girlfriends in New York that I'm going to see when I'm out there, and you know, who doesn't want to do a weekend in New York, right? And get some lips and some Kybella
and come see me.
Yeah, so that's how I'm going to do it.
And you're gonna when you're ready, sweetheart. When you're ready.
Absolutely.
When you're ready. I love when this is all over, you know, when everybody's safe and we don't have to have our 6 feet distance. So,
yes.
You know, we have to practice our social distancing. It's very important. And you know,
the other thing I just wanted to add that I've heard you talk about, you as a nurse practitioner, you answered the questionnaire when Governor Cuomo put out we need medical personnel, and you filled out your questionnaire to help and volunteer on the front lines, and you're just waiting to be assigned to something right now.
I'm just waiting to be called right now.
And you gave blood yesterday. So
I did.
You're in there.
I'm in there. I'm trying.
Yeah, you're in there fighting the good fight.
Well, I feel like I need to help. Thank you.
Amazing.
I appreciate you acknowledging that.
It's amazing that you're doing that, and the world is a better place because of people like you. So.
Aw, thank you. You're so sweet. I'm just waiting for them to call me. I answered my questionnaires. I sent in what they needed. So now I'm just waiting for them to place me. That's just a waiting game right now. So when they call me, I'm going. That's all.
There you go. Well, that's awesome.
I'm not open now, so I'm not Botoxing anybody, so I need to go.
There you go. And you guys, I will put all of her contact information in my highlights, so it'll be there. And if you have any questions, you can reach out to her directly too as well. So thank you, Jen, for coming on with me.
Thank you, sweetheart. It was a pleasure talking to you. Bye, everybody. Have a good night, and I'll speak to you soon. Bye, sweetie.
Bye.
Take care.
Okay.
Take care.
Okay, you guys.